Hubert Humphrey once reminded us that it was once said that the moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. There are many things that are wrong with this budget. Medicaid providers are cut 8%, meaning more doctors will leave the Medicaid system, and Medicaid recipients will find it harder and harder to get basic medical care. Medical services like dental, chiropractic, podiatric, and other services are cut from Medicaid. And the budget assumes that the law will be changed to allow psychotropic drugs to be added to the preferred drug list, something that could force clients to struggle to find effective medication, and which takes a change in statute that we all know will be difficult to enact. Non-Medicaid community mental health funding is cut by $40 million. The brunt of this cut is likely to be borne by large counties like Wayne and Oakland County, the very places that have the largest populations of individuals with mental illness. On top of that, many other services that help our citizens cope with mental illness are reduced or ended. Mental health respite services that help our citizens, that provide services to parents who care for severely disabled children, are eliminated. Protection and advocacy for the mentally ill is slashed by 75%. Mental health initiatives for older adults are eliminated. The Healthy Michigan Fund has been decimated. 14 services have been eliminated and others are drastically cut, including pregnancy prevention, infant mortality, and cancer protection. While these programs fared better in the Senate-passed version than in the Senate-passed version of the budget, I cannot agree with cutting Healthy Michigan funding by more than half. This budget also cuts local public health operating funds, and we require higher payments from parents with children in the special health care program. I have heard over and over again that there will be a supplemental that will restore some of the cuts that we are making. Well, I say I don't wish to play roulette with people's lives. We can pass the Senate Democratic plan now and include a fully funded budget that does not decimate our citizens. Our caucus has spoken of a set of priorities, including maintaining medical services for the needy. We have identified ways to pay for our priorities, and I believe we should take this action now so our budget can provide basic needed services to our valuable citizens. I reject the idea that only by cutting programs can we balance this budget. Colleagues, based on the standards described by Senator Humphrey, we have failed the test of what it means to be a moral government. Therefore, I will be voting no, and I urge my colleagues to do the same. Thank you, Mr. President. I ask that my remarks be printed in the Journal.